once again, welcome back to this channel, and I am Debbie, and here with me is
Martin's Blessing.
All right, so I'm going to be asking Martin's Blessing like a lot of questions about cervical cancer, because as it is now, it is one of the trending cancers that that is affecting our women. So, like Martins, what do you know about cervical cancer?
All right, thank you for this privilege. So, cervical cancer is one of the most, or should I say, is the third deadliest cancer that affects women, especially women of reproductive age. Now, this cancer is said to be a silent killer. That is, it can be with you for a long time without showing any signs and symptoms. Now, this cervical cancer is the most preventable and treatable type of cancer, so long as it is being detected early and there is prompt and effective management. Now, cervical cancer is caused by a virus known as the human papilloma virus, and the major carriers, or should I say the major reservoir of this virus, is the male folks. This cervical cancer is a cancer that can be contacted majorly through sexual intercourse.
Wow. Can you hear that? Now, does the man be the carrier? Now go through the heat. Hey, see what we they suffer. And this, the rate at which cervical cancer is now killing women, it just like from nowhere, it just came up. Wow. So what are the signs, so that I'm for the women, so what are the signs, what are the things that these people can see that will maybe like, okay, this is a sign of cervical cancer?
Okay, so number one, there is abnormal bleeding. That is bleeding that is not your normal menstrual bleeding. You begin to see abnormal bleeding. Painful during sexual intercourse. You'll be feeling pain when having sexual intercourse. You can also see bleeding when having sexual intercourse. So you can see foul discharge, creamy discharge that has this offensive odor. You can sometimes have abdominal pain, or you can even have back pain while having sexual intercourse also. These are like some of the signs you exhibit in severe cases.
Wow. So like when they notice the signs, they should just go back to any
healthcare center around you, make your complaints. They will run 1 or 2 tests on you, and the necessary treatment will be given.
Okay, that's a good one. So because once you detect it is earlier, there's a treatment.
Yes.
Okay, so what are the risk factors? Like, who are those people that are actually prone to this cervical cancer? Like, who are these people that used to have this cervical cancer? Who are those that can just be easily exposed to cervical cancer?
Okay, the major risk factor for this condition is going to be people who are sexually active, irrespective of your age. So long as you are already indulging in sex, you are prone to having cervical cancer. Now, also those people who have sexual multiple partners, I said these diseases are usually in the men. Those are they are not obvious. They don't show. The males are the healthy carriers. So now, when you have different sexual multiple partners, if you not get from Mr. A, there's a tendency that you get from Mr. B. There's a tendency that you get from Mr. C. So when you have multiple sexual partners, you are also at risk of this cervical cancer. Another risk factor, being a woman on its own, is already a risk factor. Another risk factor, I would say, if you have low immune system, that is, if your immunity is low, if you don't eat well, this cervical cancer can be like an opportunistic infection that will come because of how your immune system is already low. If you are immunosuppressed, maybe you have HIV already, the person is prone to having this cervical cancer.
So you can hear Auntie Temodu, you want to be tested, you have to test on microphone, hello, you want to test Uncle Femi, you want to test Uncle Bolaji, you want to test Papa, you want to test all the men. You can hear cervical cancer is real. It's real.
Very real.
It's real. So guys, like now, so what are the way we can actually prevent cervical cancer? Because cervical cancer is like that, something that affects the neck of your womb, your cervix. So now, what are the ways in which we can prevent cervical cancer, like from our women from getting this cervical cancer?
Okay, number one prevention will be total abstinence from sexual intercourse, because this is like the major route to getting this cervical cancer. Then, as we all know, it's not all individuals that has this ability to abstain from sex. Now, this is where condoms come in, a barrier method. Condoms, both the male and the female condoms, it at least to some extent it can prevent this transmission of cervical cancer. Another prevention I would like to talk about is vaccination. Now, this vaccination, I will say is for mostly to those who are not yet sexually active. And that is why there's an ongoing program for girls between 9 to 14, because there's this belief that they should not be sexually active and not be active. That's why there's an ongoing program for girls between 9 to 14 years to vaccinate them against this profession, because it's expected that they are not sexually active. But for those who are already sexually active but still want to be vaccinated, there is a process. First of all, you go to any health care center around you and you go for a screening. Then after the screening, the result of this screening will determine if you are qualified for this vaccination. If you have already come down with this cervical cancer, then treatment will be made before you can come for vaccination.
Please, mothers, please don't be afraid to come to the clinic, because some of them used to have this fear that cervical cancer, because the way they talk about the cervical cancer, how deadly it is when you detect it earlier, that it can be treated earlier and you'll be able to live for for how many years you want to live on it. It is when you not keep curbing and keeping it, and sometimes they may not even really know that they have cervical cancer. That's why they said if you are active. So if you are sexually active, please go to the nearest clinic. It's not even expensive. Some of them even do it free. So go to the clinic and get this screening done. Take your children for vaccination. Just create out time, because health is wealth. So I want to ask Martins, how often do we even need? We say we should advise to go to the clinic to get vaccinated or to go for the screening. How often should they go for the screening?
Okay, so at least once in 2 years, it is usually advisable to go for screening for early detection, because it is early detection that will lead to prompt and effective management. And sorry, I want to talk about some misconceptions. There is this ongoing misconception about the vaccine. There is this misconception that says any individual who takes the vaccine will die. That is a lie. That is a total lie.
No.
Me standing here, I've taken the vaccine.
Tell
and
them.
Standing here, hale and hearty. So there is nothing like the government is trying to clear off or wipe off any generation or wipe off any. It's nothing but rumors. I'm here, I've taken it, I'm healthy, I'm here, I'm even talking to you. So that's a misconception. So please, mothers, please, in case the program is still ongoing and they come to your church, your schools, your homes also, please bring out your female child to be vaccinated. This thing, they will need it in the future. These female children, one day they'll be sexually active.
Yes, so they go do them.
That is just the truth. So now let us prevent this cervical cancer from now. Please and please. And if the program is not still ongoing, please, you can go to any nearest PHC or clinics and you can get vaccinated.
Thank you very much, Martins. We really appreciate you for sharing your knowledge. Guys, I hope this one has opened our ear. Don't be for anybody. Don't let one man go and choke any outfit for your body. Please do the right thing. Do the right thing. And don't forget to subscribe to our YouTube channel. We are for you. Midwife Light is for you. We stand for you. We love you so much. Don't forget to subscribe. Share it to those that need to get the knowledge of this topic. We love you all. I will say bye. Thank you.